Wickham Hospital has been the top local issue in this constituency all the time I've been MP, and urgent and emergency care remains people's first priority. Wickham Hospital lost its A&E department under the last Labour government, but I don't bang on about it because I appreciate it was closed for clinical reasons and not for political. Two of the biggest killers are treated right here in Wickham Hospital, where we have specialist centres for heart attack and stroke. But given that we're a growing town, local people are concerned that they should have the right access to urgent and emergency care right here in our town. And because I share that concern, I asked the National Clinical Director for Urgent and Emergency Care at NHS England, Professor Jonathan Benger, to visit our hospital yesterday and be interviewed by me so that we could learn what's the best possible practice for our hospital. Professor Jonathan Benger, thanks so much for coming to Wickham. It's hugely appreciated.
Well, thanks for inviting me.
Could you tell us a little bit about what's happened to A&E and medicine since this hospital was built to have an accident and emergency unit?
Okay, well, we're talking about the change from the 1960s through to the modern day. That's about 50 years of healthcare progress. And the obvious thing is that life expectancy has increased dramatically. So if you were born in the 60s, your life expectancy might have been about 75 at birth. Now it's 83 years. So that's 8 years on average gain per person. And some of that has been derived from modern medicine. So we've really changed the way that we treat some really important diseases. So Wickham is a good example of where heart attack and stroke are treated at the cutting edge. So we've got fantastic treatments for heart attack now. Back in the 60s, the treatment was 6 weeks bed rest. Now we have immediate angiography, stenting, patients going home within a couple of days. Similarly for stroke, there were no real treatments for stroke. And now we have really fantastic clot-busting treatments and good rehabilitation programs that have turned that around.
So in a nutshell, what has this meant for the people of Wickham and the quality of care that they receive by doing it this way instead of the way it used to be done?
So what the people of Wickham, like everybody in England, have gained is a better healthcare system overall. So access to better preventative measures, access to better care for sepsis, for cancer survival is improving all the time. And so really important developments in healthcare. The other thing that's really important is the technological aspect of this. So what networking care and modern technology have allowed us to do is they've allowed us to bring treatments right out of hospital into community settings. So previously specialist care was only available in a hospital. Now that kind of specialist care and that expertise through communications technology and miniaturisation is brought right out into GP surgeries and into ambulances. So ambulances aren't about just driving to hospital anymore. We've got skilled paramedics who are delivering treatments in the back of an ambulance that used to only be available in a hospital. And so those treatments are now embedded in our communities and they're providing urgent and emergency care at the scene, close to home.
Now, because it would be fantastically popular, as a politician I'm under great pressure to bring A&E back to Wickham Hospital, and of course I'd love nothing more than to get A&E back at Wickham Hospital. But what would you say to those people who make that demand?
Well, obviously everybody would like a world-class hospital on their doorstep, but that's just not practical. So we have centres of excellence that provide emergency care and life-saving treatment, and if we don't centralise those services into large units, the results suffer. So we only get good results when specialist centres are doing high volume work and they're doing a lot of a particular procedure regularly, so they're experts at it. On the other hand, we also need urgent care delivered close to home. People expect and need the majority of their urgent care to be delivered close to their own home, and so we need to deliver a network of urgent treatment centres networked into the whole system of primary care, NHS 111 and the ambulance service that will provide care for the vast majority of urgent problems near to a patient's home, and that would include within Wickham itself.
So Wickham would be a good place for an urgent treatment centre, but fantastic. What would it mean for the people of Wickham to have an urgent treatment centre here? What does it mean generally for a population to have an urgent treatment centre, and what would change?
So what we're trying to do here is standardise the offer to patients, so that wherever you are in the country, you can be confident of what you're going to receive in an urgent treatment centre. And our aspiration for urgent treatment centres is to develop those in a way that they can provide nearly all of the treatments that you'd normally expect in an accident and emergency department. So we've got a set of guidance about how urgent treatment centres should work. They should be open for an extended period of time consistently. They should be led by general practitioners and have a range of healthcare staff and be plugged into all the range of services that might support them. So that's things like mental health, physiotherapy, pharmacy, and links to larger specialist centres so that expertise can be brought right into the urgent treatment centres to treat people there and then rather than having to travel to a different or a bigger hospital.
So on that point of travel, one of the things which has come up locally is people needing to travel to A&E either because they've had side effects of chemotherapy or because they need follow-up treatment post-operatively, so they've had an operation, they need care subsequently. Is there something which could be done in an urgent treatment centre to enable people to get that chemotherapy and post-operative care in Wycombe without going off to A&E?
Yes, absolutely. So our aspiration for urgent treatment centres is they'll do everything possible to provide treatment for a patient close to their home. So, for example, in Wycombe. What we would expect an urgent treatment centre to do is link itself through clinical protocols and good communications technology, so video conferencing and access to information, so the specialist in a different hospital can review a patient who is in the urgent treatment centre. So the urgent treatment centre can do the necessary tests, take photographs, get at the wound, for example, and you describe a post-operative patient that might have a problem. They can then immediately speak to the specialist in a different hospital who can review the results, review the patient, and can direct care. So that the majority of that care can be delivered locally. And only patients who really need to travel will then be transported by the ambulance service to the specialist centre that they need. So our aim here is to increase the game of urgent treatment centres so that they're able to cater to the vast majority of the needs of the patients who enter them. So what accountable care systems will do is they'll create an urgent care system that's integrated, that draws in all those elements I've described, so primary care, 111, ambulance services, urgent treatment centres, A&E departments, and the very specialist facilities such as for heart attack and stroke as you have here in Wycombe, and will make that a functioning system for patients. So wherever they enter the system, they are directed and guided to the right place that will resolve their problems. Now what I'm seeing here, and I've been privileged to have a look around today and look at the facilities you have here, which I think are outstanding, is also the community hub principle, where Wycombe Hospital itself is supporting smaller community hubs closer to patients' homes. And that's exactly what we want to see. So the principles here are that urgent care should be delivered close to a patient's home wherever possible, but just occasionally patients will need to travel to a specialist centre for expert care and life-saving care where that's necessary. I think people should be optimistic. The advances that we're making are very impressive, and we're working really hard to bring together the urgent and emergency care system to deliver an effective system that really responds to patients' needs in the future.
Well, Professor Jonathan Benger, thanks so much for coming to Wycombe. I know it's meant a lot to everybody in the hospital, and it's meant a lot to me, so thanks very much.
Thank you for inviting me.
We've heard from Professor Benger, one of NHS England's top clinical directors, how healthcare has been transformed, dramatically improving over 50 years. From the time when that hospital, our hospital, was designed to have an A&E, but the treatment for a heart attack was bed rest and there was no practical treatment for stroke. Instead today we have expert centres right here so that our families can get the treatment that they need for some of the biggest killers. So I'm proud of what we have here in Wycombe, but what we need to do is move forwards, never backwards, move forwards to a time when we can all be confident that we can get the vast majority of the treatment that we need right here in Wycombe in an urgent treatment centre.